Hi, my name is Simona Cipriani. I'm here at the Art of Control in Stamford, Connecticut, and also the home for the Art and Science of Contrology teacher training program. Tina is with us to demonstrate the second exercise of the abdominal series, the double leg stretch. We're going to start with your knees bent into the chest, and I'm going to show you a demonstration of a modification of the exercise first, and then we're going to do the actual exercise the way it's meant to be performed. So for knees conditions, you want to have your hands under the thigh so that your knees can be a little bit more open, and also the knees can be together, or the knees can also be separate. So whatever it's easier and it feels more comfortable for your knees, that's what you want to choose. Some people feel a little bit more comfortable if the knees are a little bit apart, and some people will feel more comfortable if they stay in parallel position here. Okay, either way, what your focus is really should not be on the lower part of the legs, but should be really on the upper thigh area, low back, and also the lungs. So when you press your thigh or the upper thigh into your chest, you really want to think about incorporating the breathing with it, and having the ribs and your thighs really working with each other in a way that it's squeezing the air out of the lungs. So when you expel the air out, when you exhale, your goal is to really try to get your thighs as close as possible to your shoulders, to your ribs, and really feel that you work in this area here to really exhale the air as deep as you can. Of course, by doing this and bringing the upper thigh really close to the chest, you're also going to include part of the glutes, and therefore you're stretching your gluteus area. So when you extend your legs to the front wall, you're going to choose the level of your own level. So in other words, when you're stretching your legs out, the legs could be a little bit less than 90 degrees. You can also go a little bit more down. You could go down toward 45 degrees, and eventually you're going to keep going down as you progress. So when you bend your knees into your chest, remember to keep it either apart, what we call this the frog position, so your toes can also be a little bit turned out, or you can keep them together in the chest. This problem with the chest, with the knees together, is that the chest gets in the way because the legs are a little bit more close to the midline of the body, so there's not much flexibility there in terms of bringing your thighs close. So the knees apart would allow you to come a little closer and get yourself a little bit more of a stretch. Okay, so the other thing I want to mention is the upper body, neck, and head. So if you feel that you need a little support for your neck, you might have a little bit around the shoulder or a little kyphosis there. Perhaps you're not liking to have the head so close to the floor that it's a little bit too far back, so you see that the chin is coming up toward the ceiling. Anything you need to feel more comfortable where your head and the weight of the head gets a little bit more forward, so proximal into the powerhouse, is always a little better, especially at the very basic level. So I'm going to have the pillow there for a second so you can see how Tina's going to do this. And we're going to really focus on the breath. So even though this is an abdominal work, you still want to make sure that you're working through the rib cage, incorporating all the way up to the collarbone, and not just working on the abdominals and thinking only the abdominals work. So you inhale as you extend your legs to your working level position, whatever that is that day, might change. And you exhale all the way out with the air. And then again, inhale, squeezing it together. And then just maintain your hands under your thighs just for now, so that you can just continue to do it in the modification that I just showed you. And then eventually, if you feel comfortable with that, you're going to pick up the head. And then you inhale as you extend your legs in the same position. Exhale on the way out. Now, when you extend your legs to the front wall, hold it there for a second, Tina. I want to make sure that your arm is adding to the nice feel of one unit into your core, into the body. So the arms by your side of the body, you really think about hugging yourself. Bend your elbows a little. And then think about hugging yourself in. There. So I want to see the shoulders and the arms adding into the rest of the body. And then exhale and come back in. You okay there? And again, inhale. Add your arms into the body. Feel that nice strong core. So this is all one unit and this is all one unit. And you really feel that center line from the nose to the heels. Exhale all the air out. And one more time. And inhale. This is the hard part. When you inhale, the stomach wants to go up in that direction. So you have to work even deeper in the abdominals to maintain a nice strong core and it doesn't go out. And then the exhale, it's easy to scoop and really get that navel down. Good. Rest your head for a moment and bring your feet down. The second thing I want to do is actually doing this without the help of the pillow. And I wanted to make sure that now we're going to focus on the rhythm and the breath the way Joseph Pilates actually performed it, which is a little bit more aggressive in terms of getting the air out. And I always feel, and I teach this to my students, saying you want to imagine, like if you want to take the cork out of your bottle of champagne and you want to just push it out from the bottom of the bottle. So you think about really squeezing the air from the pelvis all the way up into the lungs, into your mouth. Okay, so I want to really feel like you're expelling the air forcefully, because remember the muscles of your exhale is there are many muscles that you want to engage. So you don't have to think so much about breathing in because that's easy to do, but you have to incorporate more muscles when you have to breathe out. So everything comes in. This time we're not going to do the actual modification of your hands. The arms are going to be down to the ankles, or the hands on the ankles here. And this is where you want to be if you have the flexibility. And you also want to think about bringing the heels down to the sit bone, okay? Now inhale, extend your arms by the side of your body. Really make sure you feel everything is one unit. And on the exhale, kick your bottom with your heels, really forcefully. And I really want you to think more like kicking the bottom this way, okay? Inhale, and now kick it. That's it. So if you hear her breathing, and go ahead. Yeah, so there's a kind of like a really forceful exhale. So without moving your pelvis so much. Yeah, think about more kicking your bottom if you can. A little more. Kick it. Good. So what I want to get to at some point is actually the kicking of the heels coming in this way. Breathe out. And again, inhale. Exactly. Inhale. Yes, there you go. Good. And rest. Excellent. Good. It takes a little motivation, and you also have to cue it in the way that you want it, but it really is a big difference. So try it that way and see if you like it. Now we're going to also talk about the arms and the upper body, and that's also a little bit more advanced. So at the beginning we keep everything really proximal, very strong in the core. Now that you know what to work for, you're going to expand, you're going to elongate, you want to really feel like the two opposite direction of the pole, and then again you want to keep focusing on that nice strong core. So we're going to have your arms into your ankle. You're holding in your ankles with your hands in the frog position. We're going to lift your head up. Remember to keep the shoulders a little bit off, not to roll up so much that the shoulders are coming off the mat, but you want to have the scapular, the inferior corner of the scapular on the mat, okay? So I know I see a lot of people sometimes they keep rolling really high, but really that's not what you want to do. You want to try to keep the spine pretty straight. So here I'm going to stop. I'm going to start with the arms above the head, and I'm going to have her really come up toward my shoulders. I want to see that she's really pulling back and elongating the spine. And then she's going to make a little circle with the arms going around, and then exhale all the air. So as you inhale, take the arms above your head. Feel that nice connection to the spine, and you can see into the shirt that she's really getting rid of all those wrinkles in here. She's really pulling all the way towards me. And then the other pull that creates the other opposite stretch is from the legs. So from the fingertips to the toes, there are two opposite pulls. And then the center core stays really into the mat, very anchored. So I can be here to give her a nice little stretch, and then exhale. Remember that nice strong exhale? Inhale, take the arms around, and now exhale. Inhale, and now exhale. Good. And last one, inhale, exhale, and lower your head down. Great. So now the only other thing I would like to add is that you understand what we talk about when we talk about the force going in and out and trying to work with the opposite direction. How we do that is we learn it by using the equipment and using the spring. So you start really feeling the opposition, the work the muscles are working when you're going through resistance. Like if you're in the water, in the pool, you know, that you feel that resistance. In Pilates, we do the same thing, and I'm sure you already know this. So bend your knees into your chest. Let's do it again. And this time I'm going to add some resistance for Tina, so you will see the same movement, but a different quality of movement. So I'm going to create resistance, like if I am a reformer or a pair of springs. And she's going to feel that resistance. She's going to have to work and engage the muscle a little bit more. So you're going to inhale, push me away. And now exhale, pull me in. So I'm actually resisting her. She's going to have to work a little more to bring me in. And then again, she's pushing me away. And by doing this, I'm actually going to make sure she's recruiting the muscles that are on the outside of your upper thigh. So she's working the lower and the back, the posterior part of the legs, and the glutes. So she's working the glutes there. She's really feeling the bottom, holding the legs. And when she's coming in, she's going to try to connect with the abdominus more than the upper thigh. So of course the hip flexors are going to work, but you have to switch your mentality, you have to switch your focus, and you really want to think and look inside of your head which muscle group you want to engage more. So in this case, glutes more. And then in this case, instead of choosing your upper thighs and flexors, see if you can get more the lower abdominal area. Nice, Tina. And now do it by yourself. And make sure now that you create, so she's recreating that motion without me now. So because she felt it before, now she's able to recreate it even though I'm not there. And that's the full expression of the exercise of the double leg stretch. Okay, now to add something fun, I just wanted to mention that the double leg stretch is something that we teach with the pelvis on the floor at the beginning, keeping the tailbone really flat because we really want to stretch more the glutes and the upper thigh. Also, it becomes a little more advanced and it becomes a little more fun if you are really incorporating the posterior tilt of the pelvis and getting more of a stretch in the low back and really trying to lift your pelvis up in the air. That's something you have to know how to do, because if you want to perform the exercise well known as going around the clock, you are going to be able to lift your pelvis. You have to really lift it up to be able to twist it and then change your direction and your position. So to finish with the double leg stretch as a preparation for your going around the clock, Tina is going to show you how to do that. So remember to lift the bottom up using your glutes and then give it a good twist. Ready, Tina? Extend your legs out to 12 and in twist. and reach, and in, and 10, and lift, 9, and lift, 8, and twist, 7, and twist, and 6. Beautiful. And come all the way down. Good. We're just going to show you halfway. Of course, you're going to be able to have fun and go all the way around. If you have a flat mat on the floor, it would be much easier. Here with the high mat, we had to add a second one so that we had enough of a platform for her to go all the way around. So have fun.
Hello, my name is Dr. Joe Muscolino, and I'm going to bring us through some of the biomechanics for the double leg stretch, the second exercise of the abdominal series Pilates mat exercises. So let's start with the modifications. So Tina, come on up and go ahead and grab as it's normally done first. When we grab this way on the lower leg, it puts the knee joint in more flexion, and that compresses the knee joint. And if the client has a posterior meniscus tear or any knee joint pathology that would create swelling in the joint, this would be a very uncomfortable position. So we can have a modification. We accomplish the same movement of the thighs and therefore pelvis and lower body, abdominal area here without necessarily causing any increased stress to the knee joint. So this is one modification to protect the knee joint. The next modification is normally, as Tina is right now, there's a little bit of a lateral external rotation of the thigh at the hip joint for what we call the frog position. But some people, they have either more abdominal mass so that they cannot come in close to their midline, or they're very, very tight and they need even more lateral rotation and even some abduction of the thighs at the hip joint. And if this is what's necessary to create the exercise, to perform the exercise, then we work with this and gradually try to work our way toward the midline, toward the normal frog position. But the challenge with doing the exercise this way is the more lateral rotation, external rotation the thigh has at the hip joint, because the gluteus maximus is a lateral rotator, it would slacken the posterior gluteal fibers and we would lessen the stretch for the posterior glutes. So we might allow this lateral rotation, but we want to try and move away from it as we can. Also, since a major part of this exercise is to expel air out of the lungs, we're not really pushing into the anterior abdomen here, so we don't push as much air out. If she can be more midline, when she comes in, she compresses on the abdominal area, it pushes on the diaphragm, and it pushes the air out of the lungs through the respiratory canals. And we have something called anatomic dead space, which is normally about 150 cc's, 150 milliliters of air that's always stagnant, that never gets pushed out. The more we push in, we can decrease that anatomic dead space, or sometimes referred to as physiologic dead space of air, so we get a more of a circulation and cleansing through the lungs this way. So the modification of being laterally rotated out might be necessary, but we want to try and get away from it in time. Okay, the next thing, Tina, bring your thigh straight up in the air. This is an exaggeration, but if her lower extremities are straight up in the air, then the center of weight of her lower extremities is almost straight over the hip joints, and there's very little challenge on the hip flexors and anterior abdominal wall compared to as she brings the thighs down more toward extension, the center of weight of the lower extremities is moving farther away, and that increases the leverage force on the musculature here. The lower down she goes, the more leverage force. Okay, relax there for a moment so you don't have to keep that. So a beginner who would be deconditioned, weaker in the beginning, you might need to have them higher up. But again, as Simona said, we gradually look to bring them down more as they become stronger, higher up in level, and better able to allow that. Okay, now let's take a look at the upper body. So Simona brought up the idea that a pillow might be necessary, but let's look at the mechanics of this a bit more. If the client has more of a rounded back, a hyperkyphotic, hyperflexed thoracic spine, what might be called upper crust syndrome, Vladimir Yanda's term for this, then what would happen is you would see that the chin would come up, and that's showing hyperextension at the atlanto-occipital joint, the head upon the atlas, and that will jam the facets back there. So lift up for a sec. So for that client, we would need to give them a pillow that would neutralize that posture of the cervical spine, the neck. Okay? So that's good there. Now, the next thing, Simona talked about the positioning of the arms, especially during the exercise when the lower extremities went out. When we keep the arms close in toward the body, proximal, close in toward the core, we're always going to have less leverage force and less demand on the body. Compared to if her arms were back here, a couple of things are going on here. First of all, because of the center of weight of the upper extremities now being farther away from the core, there's going to be a greater demand on the shoulder, glenohumeral joint musculature to be able to move this way and hold that position for a moment. Plus, the more she goes back up here, really into flexion, the more stretch we get through the pectoralis musculature, and the pecs go down into thoracic and abdominal fascia. So we're actually getting a stretch in through the upper body here as the lower body is going away. So that idea in Pilates of going in opposite directions, we're looking, just go out with your lower extremities for a sec, we're getting a stretch from the lower extremities this way and a stretch with the upper extremities this way. Go back to a comfortable posture for a moment. One more concept with the shoulder joint posture. If she goes up, and you can just show it on, yeah, we'll show both sides. If she goes way, 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 way up, which a teacher might ask a client to do, that's going to be a lot of compression in the back of the glenohumeral joint. And there might be a problem with impingement there. So generally we look to go not too far back, so we're not getting too much compression on the posterior glenohumeral joint, more the level of the ears as we see here. Okay, come on back. So these are most all of the modifications for the double leg stretch. Now let's take a look at the biomechanics of the exercise itself and some of our considerations. So we'll take away the pillow. We don't need that there. So the first thing is that Tina's going to be asked to bring her neck up into flexion. And again, like I brought up before, we want to make sure that we don't lead with the chin. That will overly facilitate and bring in the sternocleidomastoid. We're looking for more of the deep stabilizer flexors of the cervical spine in front, anteriorly, more like the scalenes and the longus musculature, the longus colli and the longus capitis. And you can rest against me here for a moment. So we always look to check the posture of her chin, because that posture is hyperextension at the atlanto-occipital joint, and that will show that the SCMs, the sternocleidomastoids, are being overly engaged. The next thing is she'll lift her trunk a little bit into flexion off of the mat, but we don't want her to go so far that the inferior angle of the scapula lifts off the mat. If that occurs, then what happens is we're exaggerating the flexion of the thoracic spine. Again, you can rest against me here as I talk so long. One of the main goals of this abdominal series is to work the abdomen. It's not to hyperflex, make hyperkyphotic the thoracic spine. And so many of our clients have that upper crust syndrome, that excessive rounded posture. We don't want to increase that problem, that postural dysfunctional pattern. So make sure that the client only lifts the scapula off the mat enough that we keep the inferior angles down on the mat. Okay, go on down for a moment. Okay, next, let's take a look at this abdominal area itself. The abdominal area is going to be challenged two ways. So coming back again, when she lifts the cervical spine and the upper thoracic spine off the mat, we're going to be working anterior musculature here to hold that isometrically, to hold that posture. That will engage the abdomen right away. Go on down for a moment. The muscles of the anterior abdominal wall that we're engaging would be the rectus abdominis, straight up and down midline. Rect means straight. Rectus abdominis, rectify the matter, get it straight. Rectus abdominis is straight up and down on the anterior abdominal wall. Then we have the external abdominal oblique and the internal abdominal oblique, which cross each other on each side. And they get more involved usually with lateral flexions and rotations, but they can also be involved with a pure sagittal plane flexion to help out the rectus abdominis. These are the three anterior abdominal wall muscles that have some vertical direction to their fibers that would be engaged to hold the trunk up into flexion. Now, the fourth anterior abdominal wall muscle, what's sometimes referred to as the corset muscle, is the transversus abdominis, and it traverses across. It is horizontal. That does not get involved with sagittal plane flexions, but it does get involved to scoop and hold in the anterior abdominal wall. When you see a client come up, you do it the wrong way, and you see that belly start to protrude out, we know that they're not holding in their anterior abdominal wall. We need to cue them and get that transversus abdominis to engage better. Okay, so go on down, relax. So all four anterior abdominal wall muscles are being engaged here. Three of them more for vertical sagittal plane engagement, and one to go horizontally across to stabilize and hold the abdomen down. And we said that they're being brought into play by the cervical and upper thoracic spine coming up, and that's true, and that's especially true for more of the upper fibers of these anterior abdominal wall muscles. But they're also being brought into play for another reason. Will you bring your thighs out into the air for a second? So straighten out your knees. When she does this, she's in flexion of the thigh at the hip joint. Relax down for a sec so you don't have to hold it. We can show it now. Certainly, when she goes up into the air that way, she has to work the flexors of the thigh at the hip joint. And there are actually 12 of them running across. And if we go from lateral to medial, we literally have the anterior fibers of the gluteus minimus, anterior fibers of gluteus medius, tensor fasciae lati, TFL, rectus femoris of the quads group. We have the sartorius, the iliacus, the psoas major, the pectineus, the adductor longus, the gracilis, the adductor brevis, and the anterior head or anterior fibers of adductor magnus. Those muscles are all having a load placed upon them to ask them to contract to hold the thighs into flexion. And certainly that will strengthen them, and that can be a good thing, certainly. But all of the flexors of the thigh at the hip joint, they don't just pull the thigh toward the pelvis anteriorly, they also pull the pelvis toward the thigh anteriorly, and that would create, and let's just have you bring your hands here so we don't block the view, that would create, can you go into an excessive anterior tilt? That would create an excessive anterior tilt posture of the pelvis at the hip joint. That would then bring the lumbar spine into excessive extension or lordotic curve, which would jam the facet joints, and that's not a comfortable or healthy posture to be in. Go on down. So we need to keep the pelvis from anteriorly tilting. We need to stabilize it. How do you stabilize a body part? By creating a force that would stop it from moving the way it would move. It would move into anterior tilt, so we need to engage posterior tilt musculature of the pelvis. Who are the posterior tilters of the pelvis? The anterior abdominal wall muscles that have any vertical direction to their fibers. Certainly rectus abdominis, but also external abdominal oblique and internal abdominal oblique. So this is the way that we're challenging the anterior wall from both directions. When the thighs are out into flexion, hip flexors engage. Therefore, the anterior abdominal wall muscles must engage isometrically to create a posterior tilt force on the pelvis to stop the pelvis from anteriorly tilting. Now, by the way, the gluteal fibers, in fact, all extensors of the thigh at the hip joint, the posterior fibers of gluteus medius and minimus, as well as the gluteus maximus, and even the hamstrings, and actually the posterior head of the adductor magnus, all extensors of the thigh at the hip joint are also posterior tilters of the pelvis. And therefore, they would somewhat be challenged to try to stabilize that pelvis to stop an excessive anterior tilt. A term that's used to describe the coordination, the balance, the rhythm between movement of the femur, the thigh, the femur, and the pelvis is femoropelvic rhythm. So we look at the relationship between what happens with the femur moving and what happens with the pelvis moving, and therefore what happens to stabilize the pelvis, which would be strongly the abdominal wall, anterior abdominal wall, hence this is the abdominal series. Okay, so now let's take a look at some differences here. Go back to our normal posture. This is the double leg stretch. Let's compare it to the single leg stretch. The double leg stretch asks for both thighs to come up. That is a greater load on the flexors of the hip joint, and therefore they strengthen even more. And it's a greater load on the stabilization anterior abdominal wall musculature, and therefore they strengthen even more. And of course, Simona's brought this up. We're bringing two thighs up. We're getting a really nice expulsion of air from the lungs out this way compared to what the other single leg stretch abdominal series exercise would do. Okay, now let's take a look at what's going on muscularly at the hip joint itself. So can you go through this, you don't have to worry about upper body. Go through this exercise for lower body and just do it nice and comfortably and slowly. As she comes up this way, stop for a sec, she was flexing the thighs at the hip joint. So the hip flexors had to concentrically contract, shorten, contract to create that motion. Then as she goes out, she needs to initially engage the extensors of hip joint extension, and just go ahead and go back and forth to initiate it, and that would be anything from glutes to hamstrings. But once she gets, go ahead, once she gets from this point further, gravity would create the extension of the thighs at the hip joint. So she needs to eccentrically engage the hip flexors to slow down gravity if she's moving slowly. Now, can you do this more quickly? But if she's going faster than gravity would go, then we need to actually concentrically engage, keep concentrically engaging the hip extensors, and only at the very end, when we slow it down, do the hip flexors need to eccentrically engage to break that motion, to slow that down. So go ahead and go through your pattern. There we go. Okay, now go into a comfortable posture here. Now why don't we put the whole thing together with the upper body. There we go. There, hip extension, hip flexion, hip extension, hip flexion. Concentrically engage extensors, concentrically engage flexors. As we go out and we go faster, the more load on the muscles to work a bit harder. Beautiful. Now let's talk about the knee joint. Okay, go back to a comfortable posture for a second. We have the knee joint in full extension at the end. That means that we need knee joint extensors to work, and that would be the quadriceps femoris group, the quads. There are 4 quads. There's the rectus femoris down the midline. There's the vastus lateralis on the outside, the vastus medialis on the inside, and the vastus intermedius, which is in the middle and goes around on the outside. All four of the quads would engage to hold the knee joint in extension against gravity. Just go ahead and show it on the left side. Just extend that knee joint. Gravity should make the knee joint collapse into flexion. The quads engage here to prevent that from happening. Go on down to be relaxed. And especially the rectus femoris would be called upon here because it's also a hip joint flexor. It's the only one of the four quads that also crosses the hip joint. Now, as we go in here, I just want to talk about stretching now. Come on up here. When she comes up in and pull yourself in, that's going to stretch because she's in hip joint flexion. It's going to stretch, theoretically, all hip joint extensors. But because the knee joint is in full or a lot of flexion, the hamstrings will be slackened and relaxed across the knee joint. Therefore, the hamstrings will not be stretched very efficiently here, and instead, the glutes are the focus of the stretch. So we get a nice stretch across the glutes here. Simona brought up the idea that as a person becomes more advanced with this, or if we want to incorporate that around the clock exercise, then we could let the pelvis come into more posterior tilt and lift off the mat. And if that occurs, then the stretch starts to leave from the gluteal area and the stretch starts to go up into the lumbar area. And therefore we start to look at stretching the extensor musculature of the lumbar spine, the paraspinals, in other words, the erector spinae and transversus spinalis, as well as the quadratus lumborum, the QL. One last piece here is that extra kick in with the body is to, go ahead and show it the way Simona showed you, is you kick in even more. When she does that, she's bringing the legs into a more powerful flexion there, which means she's really working the hamstrings there, as well as the hands adding in by pulling the knee joint into flexion. But she's bringing that leg against the thigh into flexion, and that's going to work any flexors of the knee joint. And the hamstring group is the primary group that does flexion at the knee joint here. Okay, relax on down. And that is the double leg stretch of the abdominal series.